Welcome back. Dr. Sanjiv Lakhanpal is a board certified in cardiovascular surgery. He specializes in the field of venous insufficiency, which means he's dedicated his career to the diseases that affect blood and other fluids getting back to the heart. He's very well published in journals like the Journal of Vascular Surgery and Phlebology. He has been on the Governor's Task Force for Cardiac Surgery for the state of Maryland. He is the founder and currently leads Center for Vein Restoration and Center for Vascular Medicine. So welcome.
Thank you.
We are happy to have you here today.
Thank you.
So we want to start off with a couple of questions that we have. We have one that comes in that says, my aunt, who is a school teacher, tells me that by the end of the day she feels that her shoes have shrunk. So what does that mean?
That's a special shrinking shoe. No, I'm just kidding.
Look, I'm like, yeah, it is. The doctor said so.
So, see, when we stand up, blood has to go from your tippy toe back to the heart against a gravitational pull of about 100 millimeters of mercury.
Okay.
Now, to send the blood back to the feet, we have a heart, but there is no such heart in the legs.
Right.
So what happens is, especially in people who have to stand for a long period of time, like teachers, nurses, surgeons, postal workers in a lot of cases we see, throughout the day this blood starts collecting down in the feet.
Okay.
And it's actually the fluid part of the blood. And it's not that the shoe is shrunk, but your foot has gotten bigger, consequently leading to the feeling that my shoe has shrunk. And your aunt is very perceptive because that is a very common finding that we see.
Right, and you see, we just saw the pictures of the legs swelling. So is the swelling always worse at the end of the day?
This kind of swelling, venous swelling, would be worse at the end of the day. So when a patient has swelling, there could be multiple reasons why they have swelling, right? So the reasons could be those that affect the whole body. So for example, it could be the heart, it could be the kidneys, it could be the liver that is causing the swelling. In that case, the swelling would be there throughout the day.
Okay.
May get slightly worse if somebody stands for a long period of time, but venous swelling will be worse at the end of the day.
At the end of the day. Okay. Now, does the venous swelling, does it only affect the legs or can it also affect other parts of the body?
Most commonly the legs, because the reason that I mentioned, when we stand, it's the gravitational pull. But if somebody's vein in the arm has a problem, then they could get venous swelling in the arm also, but 99% of the times it's in the legs.
So when you talk about the gravitational pull and it's difficult for it to get back from the foot back up to the heart, will this affect both legs or do you commonly see it just in one leg?
Great question. It depends on the reason, right? So if this pathology is there in both legs, it'll affect both legs. So it's those little tiny valves in the legs and the veins of the legs. Now, veins are like conduits which carry blood back to the heart.
Right.
They have little valves. If the valves are not working in both legs, then you'll have it in both legs. If the valves are not working in one leg, then it'll be common in
just
one leg.
Just in one leg. So tell me, what exactly is swelling?
Swelling is fluid that exudes out of the conduit and collects in the intercellular space. So that's the tissues around the conduits have more fluid than what should be there.
Okay. And what should patients do when it comes to swelling? What are the next steps?
The first thing is, if you feel that you've got abnormal swelling, you've got to contact your primary care physician. Because swelling, it's like a plethora of things that lead to this swelling. It's not just venous in origin. So you got to get all the tests done that your primary care doctor recommends at that time. So let's talk about that a little bit. So if somebody is 35 years old and has swelling in one leg only, then usually it's of venous or lymphatic etiology, and that's the direction that your primary care doctor will go in testing things out.
Okay.
However, if it is affecting both legs and you're 70 years old, then the doctor will start with checking your heart and kidneys out first.
Gotcha. All right. It's so much information. I wish we had more time. Thank you for joining us today.
Thank you. Thank you very much for your time.
Thank you. Stay with us. We have more of Let's Talk Live coming up right after the break.